Back injuries are one of the #1 causes of folks seeing their doctors in the United States and worldwide. As a rehab doctor, I have seen hundreds, if not thousands, of patients for back pain specifically, and I myself am no stranger to back injuries as well. So here's what I do as a rehab doctor whenever I hurt my back. First thing, I do a little mental kind of math here and figure out what's the likely structure that's injured. So the mechanism of injury is super important, and that is way too detailed to go into in a short video. But as long as it wasn't a kind of heavy loaded twisting type motion with no prior back injuries, it's not quite as likely that I've herniated a disc and pressed on a nerve. Absent those, it's your typical myofascial strain. So you hurt the muscles in your back, they're cranky, tightened up to try and protect you from a second injury, and they just won't relax. So I gotta convince them that it is safe to relax. How do I do that? Get moving. The worst thing for back injuries is laying on the couch or laying on a soft bed mattress or any sort of inactivity. My most recent back injury was when I was getting off of the 10K. I went training for a powerlifting competition and I went from running distance to lifting heavy within 24 hours of each other. I strained a muscle called the quadratus lumborum, which connects your rib cage to your pelvis. That muscle was already a little tight from running because my running form is not the most graceful as a 200-pound guy built like the Kool-Aid Man sometimes. That was a pretty sharp pain in my right lower back, and the first thing I did was stop what I was doing. The second thing I did was get to walking. I didn't put any new load on the back, I didn't do any sort of heavy workouts, but I didn't stop moving. I made sure I got my extra steps in. I was not sitting as much as possible. I was walking around the office in between patients, that kind of thing. I avoided anti-inflammatories and instead used heat. This way my body kind of knew where the injury was and focused on sending all the sort of healing factors and stuff like that to that area so I can get it nice and relaxed and back into a recovery sort of process. As soon as I felt good enough to start putting a little bit of weight there, I would do more shallow range, what we call rack pulls. And there's some debate over how to best go about this, but what I would do is I would put some light weight onto a deadlifting bar and hold it in a position where I could feel those muscles engaged, but I was in perfect alignment. So my low back was nice and flat here. I was holding it like this. I could feel the engagement, but I knew I wasn't putting any additional strain on there. I wasn't forward flexed too far at the hips or anything like that. Instead, those muscles were active, but not overworked. I eased back into those movements and I increased the weight slowly. And as long as the pain never really exceeded a 3 out of 10 at any given time and went down quickly after stopping the activity, I was able to continually increase the weight I was loading onto that sort of muscle in that area and was back to powerlifting in a few weeks. That being said, always talk to your doctor because this area in particular, if you are prone to injuries or any sort of structural abnormalities, can be a very different picture and can cause permanent damage if treated incorrectly.